107.9 FM. Folks, it is Spencer Duby here live in the studio, and I have a studio full of some amazing people. I got Andre, the co-owner of Fort Malden Animal Hospital, Kate, the veterinarian, and Kim, the technician. All of them great people. Fort Malden Animal Hospital doing some amazing work, and they're here to talk about a pretty difficult subject. They're going to answer some questions. Palliative care, end of life, basically. That's what that means. It's never easy when you're a family and you have to put your pet down, or they kind of recommend you do it, whatever. It's kind of the step-by-step process of end-of-life care for your pet. And it's never easy, right? We've all had to put a pet down. So hopefully we learned something new here today. Everybody, welcome. It is great to see all of you and meet some of you. Let's start right off the bat. To start with palliative care, veterinary medicine, how is it different from your regular treatment?
Palliative care in vet med is very similar to palliative care in human medicine. We focus on pain and discomfort in the face of severe illness or lifelong illness. So how that differs from curative treatment is that, curative, we're trying to cure and treat the pet and try to bring it back to health with medicine or surgery.
Yes, and with that, both of you obviously seeing some early signs. What are these early signs that should people be looking for at their homes as well?
A lot of the early signs you're going to see are they're slowing down on walks. We're not playing as much as we used to. We're maybe not running up the stairs or jumping on the furniture. There's always behavioral changes where they're spending sometimes more or less time with their families. They're hiding. Their sleeping patterns change. Maybe they're sleeping during the day and staying up at night. They're pacing. They're restless. Even their food, they'll change. They may not want their kibble anymore, or they're just going to lick the gravy instead of eat all the good stuff.
If somebody does bring in their pet, how do you help families assess quality of life in a practical way, especially when they take their pet back home?
So there are some great online resources that can help pet owners kind of assess their pet's quality of life. There's one website called the Lap of Love, for example, and it guides owners through questionnaires that help identify subtle changes in their pet's day-to-day life. And one tool that we often use a lot and recommend a lot is kind of keeping track of good days versus bad days for your pet and writing that down on a calendar. And then at the end of that month, you kind of review how many bad days were there versus good days. And gives us an idea of, is that a good quality of life or not?
And you recommend people like on your own website as well to check that one out, or is this just something when people bring their pets in?
When they bring their pets in, we talk about these kind of resources and links and things like that. But we definitely have handouts that we can print out for clients as well.
Absolutely. Yeah. For the pet owners struggling out there, how will I know when it's my time? That's never something that people think about, but when it does happen, what guidance do you offer to them?
Well, I think a lot of people are waiting for their pets to give them a sign. Mm-hmm. And unfortunately, that can sometimes mean that we're waiting for a crisis. So using those online resources ahead of time can be really useful, but also keeping in mind that things like appetite is not necessarily, the only way to assess quality of life. A lot of people will say, well, they're still eating, but we really need to look at things like pain, anxiety, confusion, mobility, right, in that whole assessment. And then the other thing to look at is you need to take a step back and look at your own quality of life as their caretaker, because it can be really challenging to manage long-term illnesses in pets, right? So it can take its toll on people too. So you really need to think about that as well.
With, the people out there, do you have any advice to them, the ones that might be noticing a slight change but just ignore it because they just think, oh, their pet might have hurt themselves or they're just getting older? What do you have to say about that?
I think a lot of people will say that their pets, they're just slowing down. Yeah, they're getting older. But you know what? Talk to your veterinary team about that, because sure, they might just be getting older, but there's a lot of, maybe hidden pain there, right? That we know those subtle signs, and we want to help our clients piece out what those subtle signs are too, and get medication on board and get supplements on board, work as like a preventative, goal, essentially. Not waiting until they are completely down and out and can't get off the floor kind of thing.
Absolutely. Yeah. So if you do notice a change, pet owners out there, don't think twice about bringing them into the vet, just to be sure, because you never know.
Yeah,
you never know. Alrighty, folks, we're going to take a little break here on 107.9 FM. Myself, Andre, Kim, and Kate will be right back. 107.9 FM, Spencer Duby here, live in the studio with Andre, one of the co-owners of Fort Malden Animal Hospital, Kate, the vet there, and Kim, the technician. Everybody, this has been really knowledgeable so far. This is great. Can we just jump right back into the questions? Because there are a bunch, and I love the information that I'm learning firsthand. So all the listeners out there as well, this is phenomenal. Can you gently walk us through what happens during a euthanasia appointment so families know exactly what to expect? 'Cause it's not easy.
Yeah, at Fort Malden, we do have a comfort room that's dedicated for these appointments. It's in a quieter, more peaceful setting away from all the hustle and bustle. So at the beginning of the appointment, one of the team members will discuss your aftercare options, any memorial keepsakes that we're thinking of doing, and we'll get all that paperwork stuff done out of the way. We go get the veterinarian for you. They'll come in and review the entire procedure, prepare a sedative for your pet, because we want them to be as calm and as comfortable as possible during all of this. After we've done that sedation, we do put in an IV catheter just so we can make everything as smooth and peaceful as possible. When it comes to that final injection, it's always painful. Painless. It's always peaceful.
It's painful for us.
It's painful for us, for sure. We usually have owners comment on how gentle the process is.
Oh, that's really good. The process too, like how long would you say this takes to set it all up?
It depends on the owners. Mm-hmm. We try and work at their pace. We know how difficult the decision is. Some people need time, and that's fine. They have that space to stay as long as they need. Some people want to make it a faster process so they can go home and deal with their emotions there. Procedure itself can be quite short, 10, 15 minutes.
Yeah.
But we want you to stay for the length of time that you need to feel comfortable to go home again.
That's great. That is really nice of everybody there. So homeowner or pet owners, they have a sharp eye. They're learning about this. What are some differences? Because cats and dogs, those seem to be the two most common household pets. What are some differences that they can spot between cats and dogs that when they start showing signs?
Well, I think cats they're masters at hiding any sign of illness or pain or anything like that. So it can be really hard for owners to notice those things in their cats. I personally have a 17-year-old cat at home, so I know, what I'm seeing, and things like sticking to one room and not venturing all over the house like they used to, right? Sleeping in one spot and that spot only. Avoiding stairs or being very stiff on stairs and actually noticing them going slowly downstairs or avoiding stairs altogether, right? And sometimes it's a complete change in behavior. My senior cat didn't really like to be picked up and cuddled. Now she loves it, and that's odd, right? This change in behavior. So things like that, but and then just noticing her little changes in her eating habits and how she doesn't really go by a schedule anymore and just will kind of nitpick at her food here and there. So little subtle things like that, especially for a cat. Absolutely. Yeah. For a dog, it can be a little bit more obvious. They might be limping more or limping at all. They're not always going to cry out in pain, though, which I think owners are waiting for them to cry out in pain, but they're going to hide that. They're going to hide all of that. So not jumping in and out of the truck or the car like they used to, not playing tug of war anymore, right? Being a little bit grumpier or not wanting people to touch them, certain body parts, things like that.
A question that I have, because I've been thinking about this, is there any other animals other than cats and dogs that you can book a euthanasia appointment for? Is there any other type that you put under?
Certainly, yes. Little pocket pets, rabbits and rodents and in particular. So we also offer the services for them as well.
This is probably a tough question, but are there some signs to look for with them that are pretty similar to dogs and cats, or are they kind of different when it comes to like the pocket pets?
They're even better at hiding their illness, I feel like. So it's really got to be about their appetite, right, and their demeanor and how they're acting. I think owners of these kind of pets they're more in tune with them. They have to take, care of them in a different kind of way. So I think they're a little more in tune with those kind of things. And sometimes it's very obvious, like masses, lumps on their bodies and things like that. Yeah.
So always be checking over your little friends.
Yeah, exactly. Yeah.
Well, folks, don't go anywhere. We still have plenty more to learn with Andre, Kim, and Kate here on 107.9 FM. We'll be back right after this. 107.9 FM. Well, hey, folks, it's Spencer Duby here on 107.9 FM's Midday Music and More show. And if you're just joining us, you know that we had a very special interview today, and we are still in the process of that. So I got Andre and Kim, the technician, and Kate, the veterinarian, Andre, the co-owner, all these amazing people from Fort Malden Animal Hospital. And we're talking about a pretty difficult subject, end-of-life care for your pet. We're going to get right back into the questions. We're learning a lot. I'm learning a lot. Hopefully you out there, the listeners, are learning a lot. So ladies and gentlemen, from a veterinary technician's perspective, what role do you play in keeping both pets and families comfortable during this difficult time?
So my role is really to make everything go as smooth as possible. I'm there to help the veterinarian, but I'm also there to help you get through this. I ultimately want this to be as positive an experience as possible. Mm-hmm. I want you to look back and not think, oh, that was one of the worst days I've ever had. I want you to be able to look back and say, what a beautiful end to a beautiful life. And if that's getting on the floor and cuddling with them, giving them all the treats we have in the room, that's what I want you to do. I want you to share your good memories of them with me. And if I've been lucky enough to be a part of their lives for a couple of years, I want to share what I remember too.
Yeah, absolutely. I love the mindset you all have at Fort Malden Animal Hospital. Literally make it just about the pet and the owner, which is great. And you're there for the owner afterwards and give the pet the best care possible. It's truly phenomenal. Many people will feel guilt around end-of-life decisions. What would you say to someone carrying that weight?
That's a common feeling. To feel that way as a pet owner, absolutely. And I mean, since our pets can't speak for ourselves, they trust us to make that decision for them. So we kind of consider it like an act of love, right? Mm-hmm. It's a gift that we're giving your pet after the years of devotion that they've given you.
Yeah. And with that, the comfort care strategies, because you're the owner and you're prepping. You've been told, we really should put this animal down, and you're going to do it. So, what are some comfort care strategies families can use at home in a pet's final days?
So essentially, we say spoil them rotten. Not that they're not already spoiled rotten, but we encourage, we recommend that you try to encourage them to eat like any kind of pet food, variety of pets food, but people foods too, right? It's really just about seeing if we can get their appetite up a little bit, creating an accessible environment for them, one that they can move around and not have to maneuver stairs or anything like that. Letting them go outside if they're interested, and just either sitting on the porch or going for short little walks so they can sniff the neighborhood. If they're interested in that, then absolutely continue to do that.
I got a question for everybody. Mm-hmm. What drove everybody to go and work with pets? Doing what you do, because it's not easy. There's great moments, obviously, but then there's obviously the hard moments. What drove everybody to do this? Just the love of animals?
Yes, absolutely. Yes. The love of animals more than people. No. And just that animals were always my friends. You know what I mean? Like I found as a kid, I feel like my best friend was my family cat, Mm-hmm. And personally, I read James Herriot growing up. So that's what inspired me as well. But,
I seem to understand them better than I may understand people sometimes. Mm-hmm. And they seem to understand me. Mm-hmm. And I know that they need someone to speak for them. And I want to help them get their message out.
Mm-hmm. Absolutely. Yes. Some days, most days, I'd rather be around pets.
Agreed.
What about, I'd love to hear from you, Andre. We haven't even heard from you yet. And I think this is a great question. We need to hear from the co-owner. The answer.
Thank you. Yeah, I usually leave it up to our talented team here. I'm going to have a biased answer because I come from human healthcare. So I primarily treat humans. I do love pets. Humans, I love them too. They can be a little difficult. Mm-hmm. Pets, when you get home at the end of the day, seeing they're always so happy to see you. Like, even those antsy cats, they'll have their moments where they come up to you and they're like, hey, it's petting time. And it's just the unconditional love that you get from them that is just so heartwarming. It also makes end of life very, very difficult. Absolutely. But yeah, that for me, yeah, I love treating both humans and animals, truthfully. Although from my perspective, we're treating them as watching it.
Yeah, exactly. This has been phenomenal so far. I've learned a lot. I really didn't know too much about end of life care. Only been through it one time myself, so didn't really expect it to even be end of life care, but kind of didn't even have the time to really process afterwards that it was, and just kind of that day was a blur for me. So someone like myself who's just shell shocked finding out your pet should be put down, probably should bring them in right now because they have whatever type of disease going on. In my case, it was cancer. So for someone that was shell shocked like me, what do you specifically do there to really kind of make sense of the situation for them? Because I'm not putting down where I had to euthanize my pet or anything. It's just they had a job to do. Do you do anything a little different there to help the people out, like kind of just bring them out of this daze that they're put in?
I think Kim said it very well in that we try to make this a positive experience. We know this is hard. It's very hard. It's heartbreaking. But we try to make this as positive as we can. We share stories about their life. I always ask about what they look like as a puppy or a kitten. We try to get the owner talking and remembering those good moments. I think that's, our team just really tries to connect with our clients in that moment. And as Kim was saying, we allow the client their space if they want it in that, in that appointment. If they want to spend half an hour, sitting with their animal, absolutely, right? It's something that we make sure that, that we connect with all of our clients.
Mm-hmm.
We know it's hard too going for, you don't think you're having a euthanasia appointment and it turns into that. And we know that owners leave and they haven't fully processed it yet. And call us the next day. Yeah. That's fine. Call us. We'll talk to you about it. It's not a problem.
Wow. That's amazing.
There are some great resources too for after, if you're really struggling afterwards, and a lot of people do, with that guilt and with that loss and not having the animal in their life anymore. So the Ontario Veterinary College has a really great, it's called the OVC Pet Trust, and they have a great pet loss support resource hub. And they just added a sort of a 6-part documentary on there that is really helpful and goes through, people's experiences. But there's some great articles on there to read. And then there's links for actual support, hotlines and groups and therapists that can help with that too.
That's great. This is like service that I've never heard before. That's great. Call you the next day if you really need to and talk about it. Wow. Amazing. Folks, we're going to take our final break. I'm kind of blown away right now. Definitely, if you ever have any concerns or you know it's time for your pet, get in touch with Fort Malden Animal Hospital. We will be right back. 107.9 FM. This has been an amazing interview so far. If you're just joining us, folks, it's Spencer Duby here live in the studio. I have Andre. He is the co-owner, I have Kim. She is the technician. And I have Kate. She is the veterinarian. All of these amazing people from Fort Malden Animal Hospital. And we've been talking about a very difficult subject, end-of-life care for your pet. Have a couple more questions. If anybody did miss this, it's going to be either on our YouTube page. You can find it there. And you can check it out on our website as well. We have them on there now. You just look for interviews in the side panel. It's great because you can find anything that we've done on our website in case you don't know how to work YouTube. So this is a very difficult subject. We're all dealing with a little PTSD as we come up here to the end. A couple more questions for whoever would like to answer. What options are available for aftercare, and how can families honor their pet's life?
The most common aftercare is cremation, whether we do individual or communal. There's a lot of great companies out there that are very respectful and meticulous in how they take care of things for you. Individual cremation, you will get your ashes back. They guarantee it is just your pet. They'll come in an urn of your choosing. Communal, they do a small portion of the pet ashes go into a memorial statue in one of their pet cemeteries, but you will not get anything back in that case. The other option is you can take a pet home for burial. You need to check your local bylaws, though.
Okay.
Yeah. Memorial items to honor them, there's a lot through the cremation company. They'll do clay paw prints and jewelry and They have headstones, and you can go online and make up your own sort of tribute webpage to your pet where you can share photos and memories of them. At Fort Malden, we will personally do ink paw prints. We'll do a nose paw print, fur clippings at your request.
That is great. Fur clippings, I haven't even heard of that one. That's great. That is really good. Final question. If anybody else comes up with anything else, you're more than welcome to speak right after this. Just my final question. If someone listening right now facing this decision, what message would you want them to hear?
That we understand how heavy this is, but sometimes the hardest decisions are the most loving ones. And that letting them go in a dignified, peaceful way is the kindest, most respectful thing we can do for our pets.
Yeah, absolutely. There comes a certain point where it's your little fur bug is just better off.
Yeah, absolutely.
Yeah.
We personally believe that there's no such thing as too soon when it comes to an animal that is suffering from debilitating disease. I've never had an owner say that, I've had owners say, they waited too long, but I've never had an owner say, I wish I had waited for more suffering.
Yeah. Oh, absolutely. If anybody else does want to add anything, you are more than welcome to.
Pushing it towards me. Okay. Well, I could talk about how it was with my pet. Our entire team, first off, is exceptional. They're fantastic. Of course, I'm going to say this. I'm biased, but they've all been through this themselves. All of us have. We know what it feels like. It is a very, very, very difficult decision to make. For me personally, my dog, Pepper, was a Shetland sheepdog. She was 14 years old. I could see the signs coming near the end, and I was kind of in denial. I didn't really want to come to terms with it. She'd been my girl for so long. But I'm eternally grateful for the veterinarian team who talked to me about it. And they told me, celebrate the good times that you had with them, right? Don't focus on the end and how it ends. Focus on all of the good times and memories you created with them. That really did help me quite a lot. I still had a hard time afterwards, 100%, but I'm really grateful for how compassionate the care was that was provided. I'm just glad that our team is as dedicated as they are to their craft. Extremely impressive.
Yes, it is.
Again, this is going to be my biased opinion, but yeah, I love my team because of how much they care for our fur babies.
Well, learning everything today, all the services that you do when you do bring in your pet, it's really incredible. And also, right at the end here, Andre, hearing from someone like you who's the co-owner, someone out there that might be having the doubts and how difficult it is. Everybody goes through it, right? Like we just heard from Andre. And if you are kind of pushing it aside, but you should go see them, or if you notice changes, go see your vet. That's what I want to put out there. Hopefully everybody agrees.
Yeah, absolutely.
Absolutely. Well, this has been such an amazing learning experience, and to just hear everything, I'm blown away. It's literally like you offer everything, like the counseling even afterward. Andre was saying, it's low volume. That's because you basically, when these pets come in, this is almost as if it's a family member of your own family bringing in their pets. So there is a personal connection, and it's like no other that I've ever heard. So I tip my hat to all of you. Andre, Kate, Kim, thank you so much for doing this. This has been great. And everybody, I do want to just stress this once again. You can find this either on our YouTube page or our website, because there is a lot of very important information out there. So from the Fort Malden Animal Hospital team to everybody here at CKBG, I just want to say thank you. And this has been great.
Thank you for having us, Spencer.
Absolutely.